First, would you be happy to pay more tax if it meant your local NHS trust was better? I'd love your calls on this. 020 7862 2222. 4 in 5 NHS hospital trusts in England are failing, according to the latest data shared as part of Labour's promise to reform the so-called broken health service. The best and worst performing trusts have been named and shamed for the first time. It's possible to see whether your local NHS hospital is doing well or if it's one of the many deemed to be failing. So we can have a look. These are the ones that are described as the top 10. Oh, look at this if you've got an eye problem. Moorfields is doing a good job. Then we got the Royal National Orthopaedic Hospital. These are good. Christie, Liverpool Heart and Chest, Royal Papworth, that's a good hospital, Royal Marsden. Then it starts to get sketchy. And we go to the bottom. So the very worst one is at the top of the list here, the Queen Elizabeth Hospital, King's Lynn. We know the Countess of Chester because that's the hospital where the deaths were, for which Lucy Letby is in prison. Then you've got Medway, North Cumbria, James Paget, Lancashire. These are in a shocking state. And these, you can see, we're 134, 132 down on the list. So you're really taking your chances with these places. North Lincolnshire and Goole. Watch out for Goole.
It does beg the question, just how bad is the Queen Elizabeth Hospital in King's Lynn if it's worse than the hospital that all the babies were dying and supposedly being murdered by Lucy Letby. I mean, goodness knows what's going on there. And I think I'm very pleased that West Streeting's published these because transparency is only a good thing. Right?
Would you? Well, we're going to ask if you're happy to chip in and pay more tax if it meant your local hospital was improved. But I wonder, looking at that list, whether the list isn't helpful, actually, because firstly, you get all the popular hospitals people will make a beeline for.
Well, there are the reason I think it works is that there are also other financial incentives for the leaders of the hospitals. They either get extra freedom and resources if they're at the top of the list, or actually the bosses can be docked up to 15,000 in pay a year if they fail to improve. So I think that gives them extra oomph. But I suppose, yes, maybe in certain larger cities you will have a problem now where people are making a beeline.
Or they just avoid. But anyway, what do you think? A bit more tax to sort it out?
The NHS has had millions, has had billions, and it continues to have billions. If Wes Streeting, and I am a firm believer in Wes Streeting, I think if anybody can sort things out, that he can. That he seems to have a great grasp of things, and he's a man with a vision. And if he can sort it out, make it work properly, cut the waste, cut away the dead wood at the top, make it work 7 days a week, 24 hours a day, then I would be happy to pay more taxes. Okay. Because at the moment...
There's a big if, obviously.
Yeah. At the moment, nothing happens on the weekend.
Well, your lovely partner, Grant, was in hospital.
Yeah, absolutely.
So you've seen the whole thing from the inside.
I've seen the whole thing from the inside in the last 8 weeks in 2 hospitals. And I have to say that some of it works brilliantly and some of it works badly. Some majority of nurses are angels. There are a lot who are not. There are some who are downright dangerous.
Really?
Yep.
OK. Linda in Leicestershire, hello. Linda, what's your local hospital? Have you seen it on this list?
No, not yet. And I'd like to think we're sort of slightly higher up. I'm very proud of the University Hospitals of Leicester.
I can tell you where you are. You're 101.
101? Oh, gosh. All you can do, the more money you throw at it, all you're going to do is create a level higher than the nurses, higher than the doctors, not for the patient's benefit.
Well, you mean you just create new managers?
I don't think we need more managers.
No, but so when you say a level higher, you mean if you put more money in, they will just take on managers?
Levels. We want to stop creating these top levels. We want to stop creating posts. I've worked for the NHS for 30 years. Some of these posts I've never even heard of, leave alone what do they do.
Yeah, I know, I understand.
And that's where the money is. As, your panel have said, the NHS gets an awful lot of money, but where do they spend it? And that's the thing. Yes, of course we need to be open 24/7, 7 days a week, But I really don't know what the answer is. But throwing money at it is just not. I've met former colleagues and people, and they're still working in the NHS. They've got these jobs that I've never even heard of. And I say, well, what are you doing? Oh, well, we're doing this and that. I say, is it working? No, it's not. So what are they being paid thousands of pounds a year for?
So, yeah, well, I mean, that's very odd if those jobs exist. I think it's extraordinary. Thank you, Linda. Terry's in Liverpool. Let me tell you, Terry, I think your local hospital is 115th. Liverpool University.
No. Morning, Jeremy. Morning, panel.
Sorry to bring you that news.
No, not a problem. I think everyone should pay more tax.
You think we should?
Yeah, definitely.
OK. I don't know whether that'll sort it, but what if you put 5p on income tax, you've got a chance, I suppose.
Well, can I give you an example? Sorry to butt in, Jeremy.
No.
You know, I get a little private pension of £42. I don't know where it comes from. I've done that many jobs. Out of that £42, I pay £21 tax.
Oh.
So I'd put up, you might as well take £30.
Yeah.
You know what I mean?
Yeah.
That's the way I look at it. Because it's going to fold, Jeremy, otherwise. Another thing, I would amalgamate trusts.
What? So in other words,
AI is coming into force.
Yeah.
Amalgamate trusts. There's too many trusts around this country.
Yeah.
Have the North Trust, Southern Trust.
I was going to say, Terry, I agree with you. I think they should be amalgamated, and also the procurement, surely, of there's a lot of money that goes on procurement of equipment and drugs and God knows what else. And I think different trusts pay different
I
amounts.
would hope they'd
It's
centralise
mad.
that at least. I don't know. I mean, the one that people always say is you get a pair of crutches, and if you get better, you bring them back to the hospital, they just throw them away.
But there is enormous waste. There is enormous waste,
Yeah.
and it starts from the bottom level.
Yeah. Thanks, Terry.
I was relieved that Terry sort of said that this is, if we are wanting to pay more tax, it's something we've all got to do. You know, he didn't just do that cop out of, well, the wealthy need to pay more, because he's right. You know, if you look at the amount we're spending on the NHS, the reason why I think I'm hopeful that Wes Streeting might make a better dent of his problems than other ministers is that this government is chucking cash, right? By the end of this Parliament, we're going to be spending 49% of day-to-day government spending on the NHS and social care. We are becoming, I'm afraid, a health system with a country attack. and I'm just concerned that I think people would probably be more willing to spend more money if it felt like spending more money improved things.
Yes, exactly.
But we seem to be spending, you know, for all
Well, of course, I mean, listen, if you put more money into it, what will happen is the doctors will go on strike and the nurses will go on strike and they'll all be paid more.
Yeah, I mean, there's partly that, but there's also the fundamental problem about an ageing population, and demand is going to rise every year.
So true.
And I don't see a way of doing that unless we bring in some fundamental changes. So maybe we start I mean, for example, we could start rationing.
Well, I mean, that's where you're heading.
I'm not talking about privatisation.
No, we were saying
what I would suggest is, for example, we need to start rationing or not providing certain services.
Well, they've
on
done
the
that with
NHS.
dentistry, right? The trouble with dentistry is the government is pretending. All governments have done this. They pretend we've all got an NHS dentist, and we know we don't.
We don't.
And they can't say the truth of it is you're on your own with your teeth now, everybody. They can't unless they give maybe dentistry only for the poorest 10%.
But the problem surely stems from the fact that coming from the GPs, and there are apparently 2 GP surgeries closing every week or every month or something, which is madness. Not enough doctors. The thing is, in the olden days, when it all worked as a system, you'd have your own doctor, and those days.
That's because they didn't have access to all the treatments. We were dying at 68. You know.
Yes, but that was just general health.
Right.
But we need to, because if people could be more treated with their GPs, they wouldn't turn up at A&E. They wouldn't have to be at A&E. They need to be treated properly.
This is so fundamental. I don't know if we can sort it. But let's take more calls and work out if you've got a suggestion. Maybe more money would do it, or do you think you could pour money into that pit and it just disappears? More calls on turning the NHS around, or maybe it's just too broken to do that. 0207 862 2222. Fred's been waiting in Somerset. Hello, Fred. I should say your local hospital trust is number 20. That's not bad.
That's pretty good.
Yeah.
I've had, good morning. I'm 91.
Brilliant.
I've done well.
Yeah, clearly.
Why is it that we have to pay? My parents have paid all their life. I've paid all my life. People that come from abroad, they come over here and they get free healthcare.
Well, healthcare is free at the point of supply to every one of us. And it's true, if you come from abroad and you fall over in the street or you turn out to have a brain tumour, you will get free treatment. You don't like that?
Well, we have to have insurance when we go abroad. Why don't they have to have insurance and pay for it when they come over here?
No, I hear you.
Can I just say
Yes,
something
please.
to you, Fred? I think that's changing because my partner has been in hospital both privately but mostly with NHS, and he got a phone call when he came out of hospital from someone whose job it was to find out whether he was entitled to free NHS treatment.
Excellent.
And
But I mean, at what point?
They
They might say, look, Grant, that's his name, you're not entitled. Then what? They try and get money out of him or what?
Well, they would have got money out of him.
How much would it be, like £100,000?
I have no idea. I have no idea. But the point being that they wanted proof that because he was born in Australia and he has 2 passports, they wanted proof that he was entitled to the NHS. He had to send his passport wasn't his British passport wasn't enough, and he had to send another proof, which was to say that he was on the British
All right,
pension.
Fred, are you satisfied with that?
Well, I'm going to have to be, but I wouldn't mind paying a little bit more if the whole thing was going to work.
OK, Fred, thank you. Let's get some more calls on. Jonathan's in Essex. Hi, Jonathan.
Hi, Jeremy. How are you?
Not bad, thanks, luckily, given the subject. What do you think?
Yes.
A bit more money?
I think so. I've just come out of hospital from Barts in London, having had heart surgery. I had a valve replaced last week. And I discussed the cost with the consultant, and they were eye-watering. It's that things are becoming so advanced in the NHS and making people much better and quicker, but the cost is extortionate.
What you so wait a minute, you had a valve replaced.
Yes,
I'll look up
valve.
Barts and see what number it is. And when he said extortionate, I'm going to guess 95,000.
I don't know the full cost, but just the valve itself was north of 20,000. Just the valve itself.
Okay, right.
Never mind all the consultants involved and the nurses and the time it took.
Yeah, but then they've got to do. They're there already, right? So there's not a cost for nurses to work on your heart. That's what they're there for.
Yeah, that's the thing. I mean, the thing is, they're overstretched. I mean, they were short-staffed.
Yeah.
My nurse almost missed a lunch break in a 12-hour shift. So I think that something needs to help the NHS a bit more. And I'd happily pay a bit more tax, actually, what it boils down to. That's the question.
There are a number of... I mean, the other thing is you could say, look, if you are weigh twice the average for your age, you can't get treatment. I'm sorry. We can't do this anymore.
Well, I have to say, Jonathan, first of all, I know Barts really well. That's exactly where my other half, Grant, had his heart operation. So I know the floor he was on, and I know the wards and everything about it.
79th on our list, so it's failing.
Well, it was pretty good for him, I have to say. And the thing is that if you do get a system that works, it works really well for people. It's fantastic. But where it falls down is actually in the people and the cost of everything.
All right, Jonathan, thanks. And I hope you get better soon, my friend.
Thank you, Jeremy. Thank you.
Cheers, take care. That's a big old operation. £20,000 valve. I thought as we got more advanced, they're supposed to be 20p. Not supposed to be that expensive.
I think the one thing we haven't really touched on, we did have a caller earlier, that chap from Liverpool, is that I do have hope that AI will answer or help us a great deal with the NHS and with medical treatment and streamlining a lot of the bureaucracies. I mean, the tech in the NHS is so out of date. I think it's still the world's #1 purchaser of pagers in the 2020s. So I do think that might help us quite a bit.
Right. Earl is in Norfolk. Hi, Earl.
Good morning. How are you?
All right, raise taxes, sort the NHS out.
Definitely not raise taxes. I am totally shocked to see the John Paget Hospital at the bottom of the list.
Yeah,
I have
it's number
used it
129.
Yeah, I've used it quite a few times in the last 3 years.
Oh.
And the service there is amazing.
Okay.
In fact, National Health in Norfolk is fantastic.
Is it now? I mean, it is. When you do a league table, it can throw up odd. Because to me, the best nurse is the worst nurse. The best nurse is the one who comes to my bed and forgets all the other patients and spends the afternoon with me. And then she gets fired because they say you didn't do a proper ward round. And she stayed with me because she cares.
The best nurse, well, that's the caring thing, that the best nurses are the ones who actually do care.
Yes.
Because there are nurses who do not care. They are, that may be agency.
Well, I bet they
nurses,
score high on
but
these surveys.
They don't care. And so therefore they don't necessarily do
Caring
a good
is
job.
inefficient. That's the problem with it. But I mean, in the end, that's what we need. Earl, thank you. What a great debate. Thanks for all your calls.